We've heard much about the importance of exercise this morning, and now we're going to hear from the very person who is the absolute guru in this area. There's a waiting list to get into her clinics at RPA. People would kill to be part of those sessions. So it's my pleasure to introduce Associate Professor Lisa Spencer. She's a clinical specialist physiotherapist working in pulmonary rehabilitation and chest physiotherapy at RPA. And her special interest is helping people with lung conditions manage their breathlessness and live the best life possible. And she's got a wonderfully engaging personality that really does connect with people marvellously. She's also a member of the Translation Education and Support Committee, which we've heard about this morning, a partnership of the CREPF and Lung Foundation Australia. So she's going to talk about exercise and pulmonary fibrosis. And that is really, I think, a key component for all of us today. So I welcome Lisa Spencer.
Thank you so much. So it's my pleasure to be here online, and I'm so very sorry that I can't be there in person, but I just know that you didn't want my virus, and you would have got it for sure. So okay, next slide, and we're going to talk about my favorite topic, which is exercise and pulmonary fibrosis. So I know we're all breathless, including myself at the moment, but it's funny that you never really think about breathing until it's all you ever think about. And this was a line, and I'm sure you've read this book by Tim Winton. This was about surfers who got caught under the waves, and they were so aware of their inability to breathe. And when I read that, I thought that described my patients so well. Next slide, please. So when people are breathless, it's very much like pain. Breathlessness stops you doing things. It slows you down. You do less and you become weaker. You have more flare-ups, end up in hospital, fear and panic sets in, and you have more breathlessness. And so the disability spiral continues. And that's why pulmonary rehab plays an important part. Next slide, please. Yep, I think you've all seen people doing this, going into a fitness centre using the escalators rather than the stairs. We all avoid exercise at some times, but when you're breathless, you become an artist at avoiding exercise. You know where every hill is, you know where every set of stairs are, and you know how to avoid them at all costs. But by avoiding them, what happens is you lose muscle strength, and that then contributes to more breathlessness. Next slide, please. So what about when you're in hospital? In hospital, it just exaggerates everything. You lose 1% of your quadriceps, that's the large muscle above the knee, 1% of that strength daily in hospital. And it does come back, but not without training. You need to exercise to fully regain that strength. And we heard before from Dr. Natasha that physical activity like gardening and so on is fantastic, but you can't get the best out of your physical activity goals unless you're strong. So that's the place that pulmonary rehab plays. Next slide. Okay, so we all think exercise is the best medicine. If it came in a tablet form, we'd all be on it, wouldn't we? And we wouldn't even have to get out of our chair. So let's think about it as a medicine, that it's the best thing you can do for yourself. Next slide, please. Is it safe for me to exercise? I have a lot of people who say, I'm frightened to exercise because it makes me breathless and therefore I think it's not safe for me. But it actually is safe for you to exercise. And that's why when you come to pulmonary rehab, we do a very thorough assessment. And yes, it's safe for you to exercise at home. Next slide, please. But pulmonary rehab is the best way to get started. And no one really is too severe to benefit from the exercise and education and support that we give you with pulmonary rehab. So pulmonary rehab, it's not one size fits all. So when you come to pulmonary rehab, it will be designed especially for you. So don't think that everybody's going to do exactly the same. Everybody's going to be working at a really hard level. It's based on your initial assessment. Next slide, please. So what does the evidence say? And we've heard a lot about evidence today. We can go straight to the next slide. So the evidence, and this is an update in a Cochrane review. And as you know, Cochrane reviews are very well-rated studies that look at a number of different research articles and they crunch all the data. And this is done by Leona Dowman. And Anne Holland's group, and Leona has done a lot of research into interstitial lung disease. So what they say from their latest Cochrane review, which is an update of a previous one, is that pulmonary rehab can be performed safely in people with ILD, and it improves your exercise capacity, your breathlessness, quality of life in the short term. But we're also seeing these benefits in IPF. And IPF wasn't studied originally, but now we're seeing the same benefits, which is very reassuring. And the improvements are being sustained longer. Early studies, we only got improvements to about 6 months, but now we're seeing those improvements are lasting longer. Next slide. So, but we do need more research. So that's why we're all talking about research today, because we need more studies to so that we know more about helping you. Next slide, please. So just again, this is another forest plot, so don't get overwhelmed by it. If you just press enter, Tara, a little green arrow will come up. So similar to the one that Dr. Chris showed you, that those diamonds you can see there are the results of all these studies crunched together. And what it's saying is that pulmonary rehab helps you to be able to walk further. Now, we know that's important, don't we? Because if you can't walk to the bathroom, if you can't walk to the post office, if you can't walk, you can't go out with your grandchildren and your family. So walking is really, really important. And that's the core of pulmonary rehab. Next slide, please. So again, this is again showing you the change to breathlessness with all these studies. So those diamonds are lying on the left-hand side of that line down the middle. The line down the middle means there's no effect, but the fact that they're lying on the other side of the line shows that there is a benefit from pulmonary rehab helping breathlessness. Now, you heard from Dr. Natasha that breathlessness can be caused from lung disease, from heart disease, but also weakness. So what we're doing is trying to change that weakness level in pulmonary rehab. Next slide, please. So let's sum that up. Pulmonary rehab is safe. It improves your exercise capacity, your breathlessness, and your quality of life. The benefits are also evident in IPF. And the quality of the evidence is still low to moderate, but that's only because we haven't done enough studies yet, and more are in the pipeline. So that's very reassuring. Next slide, please. So let's talk more about pulmonary rehab. Who should go? I always think that everyone should go and at least have an assessment at pulmonary rehab and talk to your pulmonary rehab health professional to see what you're like. Do a 6-minute walk test and see what your limitations are, if any. And from then you can make a plan about what you want to do. Early referral will ensure better outcomes. So we see greater improvements are associated with milder disease, with a higher FVC, forced vital capacity, one of your spirometry results, and less desaturation. So come early, because then you've got a plan for later on. Next slide, please. So how does it work? We don't have a magic wand. We can't change what's happening inside your lungs. We can't change your lung function. But what we do change, we have changes at a muscle level. So the way the muscles work is that there are oxidative enzymes in the tiny muscle fibers, and the exercise actually improves your ability to exercise. So it improves the oxidative enzymes and the muscle metabolism. This produces less lactic acid, and lactic acid is a driver for breathlessness. So by getting stronger muscles, you become less breathless. As I said, we can't take away your lung disease, that can help you use what you've got better. Next slide, please. So what will you do at rehab? So that first box you can see on the left is your assessment. So that's really, really important. A 6-minute walk test, a few questionnaires, but talking to you and finding out what's your biggest problem and how can we help you. Then we start an exercise program, and that exercise program, and it's different to physical activity, as I say. You have to be strong to be able to enjoy your physical activity, whether it's gardening or whether it's golf. You need to have strong muscles in order to cope with that. So the exercises, and I'll show you a few in a moment, and also education. So assessment, exercise, and education. Next slide, please. So I know you all go, no, not a 6-minute walk test. You've all done a 6-minute walk test. But it's really, really important test. It's used all over the world to assess oxygen saturation, your fitness level or the distance you can walk, and also to help diagnose the severity of your disease and how your drugs are also relating. So very, very important that we do this. And you may have had it done before and after pulmonary rehab, but you might have also had it done in the interstitial lung disease clinic. So very, very useful test for us to prescribe exercise. Next slide, please. You'll be monitored, as you know. You might have a finger probe to look at your oxygen and heart rate during that walk test. And we'll also ask you how breathless you are. That's the Borg scale. Some of you will have scleroderma, and in scleroderma, the skin on your fingers, because it affects connective tissue, becomes thickened, and it's very hard to pick up an oxygen saturation through your finger. So that's when you might use a forehead probe. So here you can see a gentleman with a forehead probe on, because we'll get an accurate oxygen measurement that way, but we won't get it if they've got clubbing or scleroderma. So that might be why you've used that when you've come to the clinic. Next slide, please. Okay, this is the form we measure everything on. So we want to know whether we do it on room air or oxygen, and we measure oxygen and heart rate right through the walk test every minute, because we know that some people don't always desaturate or drop their oxygen at the end. They might drop it during the middle of the walk test. And this is important because we need to be able to prescribe oxygen as well from your walk test. Next slide, please. So what exercises will I do at rehab? So here you can see a patient with pulmonary fibrosis on the left and a patient with COPD on the right. So whether you have oxygen, whether you don't have oxygen, exercise is safe for you. But if you do have oxygen, we'll always use oxygen for exercise. So here cycling becomes an important part. Next slide, please. And our favorite exercise is walking. This is the hardest exercise because your muscles have to carry your body weight. But it's one of the best exercises because no equipment is needed. It's just you need to practice walking, and you can start slowly and build up. It doesn't have to be a big, long walk to start with. So if you can only walk 5 minutes now, next week you could try 6 minutes. The next week you could try 7 minutes, because the muscles, even though you're breathless, are able to be trained. They're very, very clever. Next slide, please. We also do arm strengthening exercises. Here you can see very blurred photos, sorry about that. So you can use weights, you can use machines, but you don't need a lot of heavy equipment in order to be strong. Next slide, please. Leg strengthening exercise is very, very important. The stronger your leg muscles are, the better you'll be able to walk and the less breathless you will be. And the sit to stand exercises, and I know those of you who've been to pulmonary rehab probably go, oh no, I hate that exercise. I hate that exercise myself because it is hard, but it's one of the best exercises you can do, sitting to standing. It really works your heart and it builds your quadriceps strength. Next slide, please. So there are different modes of pulmonary rehab now. So the gold standard is coming to an outpatient-based program and doing face-to-face pulmonary rehab supervised. It's the supervision that makes the difference, because if you're exercising unsupervised, it's very hard to push yourself and feel safe. Whereas when you come to rehab, we will encourage you and we'll monitor you and we'll make sure that you feel that you're safe and that you are doing the right thing. But now we also have tele-rehab. So since COVID, thank you, COVID brought us tele-rehab, and we also run tele-rehab classes. And I hope most pulmonary rehabs still offer tele-rehab, but there's also hydrotherapy. So we offer all of those modes. And so if one doesn't suit a patient, we can offer them another mode so that we're still getting supervised exercise and education, but with different modes of exercise. Next slide, please. What about education? What will I learn? Education is really, really important. And as you know, because you're all here today, and that's absolutely fabulous. And as I've already heard from all the questions, you know more about your lung disease than anybody does, and that's the way it should be. But sometimes we can just help you with a few special things. So with this one, I'm just highlighting, we often do all of these things, but I'm highlighting breathlessness because that's so important to manage breathlessness. And Dr. Natasha went through a few things, and I'll mention a few in a minute. Managing flare-ups, and as well as that, increasing your physical activity, getting strong at rehab, but then transferring this to physical activity at home. Next slide, please. So education is about managing your hand better. So if I said to you, if I dealt your hand of cards, you're actually missing a few aces, aren't you? As most of us are. But you can still play a really good hand of cards. And that's what pulmonary rehab does. It helps you play a better hand of cards and manage what you've got much better than you're already managing it. Next slide, please. You've heard a lot about these things already, so I won't stress them too much. Things that help breathlessness: oxygen, using a frame, handheld fans, pacing. Pacing is very, very important. Sometimes we feel younger in our head than our lungs are. So you want to rush at things the way you always did. But sometimes learning to pace and to slow down is actually a benefit. And that's something we spend a lot of time on in pulmonary rehab. Pursed lip breathing, which is breathing through pursed lips. Dr. Natasha mentioned the rectangular breathing, and sometimes adding in the pursed lip breathing as well with that will help manage your breathlessness. Now, all of these things you will learn in pulmonary rehab, so you don't need to go looking on the website, or you can do that as well, but come to pulmonary rehab and learn all about it. Okay, next slide, please. Thank you. These are some positions that help you manage breathlessness. So we know by leaning forwards, and we've learned this really from patients doing it automatically, that leaning forwards actually relieves your breathlessness. It supports your shoulder girdle, but it also arches the diaphragm slightly, so it helps you manage your breathlessness. So don't be frightened to stop what you're doing, lean forwards, get your breath back, and go again. Now, that arrow is pointing to a person leaning forwards and using pursed lip breathing to help manage their breathlessness. Panic is a terrible feeling when you're breathless, and many people have that. So when your breathlessness just tips over the edge and you feel as if you're going to have a panic attack, stop what you're doing, lean forwards, use that pursed lip breathing, and say to yourself, I will get my breath back, but it'll take a few moments, and I'll stay in this position until I feel better. Next slide, please. What about after pulmonary rehab? What am I going to do then? I've loved pulmonary rehab. I finished the program. It was the best thing I've done. What am I going to do after that? Well, let me write you a prescription. Continue to exercise even after rehab finishes. Rehab is really about getting you fitter and stronger so that then you can do whatever you want. Well, a lot of what you want. You need to walk at least 30 minutes per day, but it doesn't have to be 30 minutes in one go. It can be 3 10-minute walks. It can be 6 5-minute walks. Next slide. And the other important thing is being as active as possible. So don't give up. Don't say to yourself, because I've got lung disease, I need to rest. I need to sit down and do nothing now because I can't breathe. You need to plan your activities, one activity a day, perhaps. Don't do everything. Or after rehab, you need to join Lungs in Action, which is a fabulous program. And that's lung maintenance programs in the community. So you can always join that after you finish pulmonary rehab. Next slide, please. At home, walking is best. Next. And you can walk with your oxygen, with a frame if it's really difficult. And you've heard a bit about frames this morning, and we're not pushing frames, but for some people, they will need a frame because they need to lean, but other people won't. So it just depends, and your pulmonary rehab health professional will advise you. Next slide, please. At home, be more active. Stand more, sit less. We know that for all of us, we should be sitting less. And especially people who work on computers all day, they're literally sitting for 8 hours a day. So you need to break up that. If you're sitting every half hour, get up, stretch your legs, walk to the front door and back. Throw away the remote control. I said that to someone once and they said, well, how can I do that? I don't know how to operate the television without the remote control. And that's probably true. So it's only an expression we used to have to get up and change the channel, remember? And now we use the remote control, so it stops us doing anything. Stand when speaking on the phone. Use the stairs rather than the lift, but you need to pace yourself on the stairs. If you're working in an office, deliver the message rather than send an email. And my favorite thing of all is do some kettle exercises, which I'll talk about in the next slide. Next slide, please. And you can just press. So kettle exercises, by this, I mean things you can do, incidental exercise you can do when the kettle's boiling or when you're waiting for something. And it might be 30 seconds of sit to stand. It might be 30 seconds of stepping up and down, some arm exercises. So we can actually incorporate lots of little exercises into our day without feeling overwhelmed. Next slide, please. Which is some more kettle exercises using TheraBand. So TheraBand is a great thing, and you could, when you finish your pulmonary rehab program, your health professional will give you some TheraBand probably, or they can, and you can use TheraBand for different exercises if you'd prefer that instead of weights. So there are lots of different ways, and we will help you design the best program for you because it's a very individual thing. You won't do it if you don't like it. So we want you to be fitter and stronger. We want you to do the things you want to do. But staying strong is really, really important, and it's different to physical activity. So gardening is physical activity. Golfing is physical activity. Exercise is planned exercise, which is designed to keep you strong. Next slide, please. So in summary, pulmonary rehab works to improve exercise capacity, quality of life, and breathlessness. Early referral is really, really important. Patients who desaturate or drop their oxygen levels during a walk test may need oxygen to exercise. And programs should include appropriate education for you. Not everybody's going to have smoking cessation if they don't smoke, but you will need breathless management. You will need how to manage flare-ups. You may have sputum as well, and you may need some airways clearance to help with your sputum. So don't delay. Contact rehab today, but actually Monday. Okay, next slide, please. Because it's about making the best life possible for you. So playing that best hand that you can play and really enjoying your life. So the last slide is just thank you very much for your attention. And again, apologies for not being there. But that's my email and my phone number at work. And if anyone has questions, I'll answer questions now, but if anyone wants to ask any specific questions, I'm very happy to answer emails. Okay, thank you.
Just query about swimming.
Yes. And what's the query? Can you do it?
Oh, sorry, is it a positive or a negative?
Yeah, swimming is great. Swimming is, as you know, has always been an exercise that helps with your breathing. Obviously, and I would start with breaststroke. Overarm is much harder if you're breathless. If you haven't swum for a while, start slowly. I would also, if I was only swimming, I would also do some walking because swimming won't translate. There's a thing called specificity of exercise. So if you only swim, you'll be a good swimmer. If you only walk, you'll be a good walker. So you need to do both if you're going to swim.
I must say I love swimming too, but
oh, good. It's lovely. It's very relaxing,
I'm into
isn't
that
it?
25-metre pool now. Thank you very much, Lisa. That was so insightful, really so helpful. We're going to be inspired to go away and really.
Oh, I hope so. Thank you, everyone.
Thank you very much.